Hi everyone, today is day 16th, that means it's September 16th of Childhood Cancer Awareness Month, and I am in the lecture hall here at Georgetown University with the famous Dr. Aziza Shad and of course Bill Tomoff, my husband. We just got done, both of us lecturing, all three of us. We started off and then Dr. Shad closed in with her late effects clinic and community tips and tricks of what people need to do, and doctors and the medical students that we talked to today about all that. So go ahead, Dr. Shad, talk a little bit about that we did today.
So let me tell you that this is the most favorite part of my year.
Wow.
Coming to Georgetown, having the young medical students to talk to,
Yeah.
and being able to talk to them one-on-one about why it is so important to take care of childhood cancer survivors as they become young adults.
Yes.
You know, from everything that we've learned, this is the most difficult population of patients to bring back for long-term follow-up. Why do you need the long-term follow-up? Because they were young. They were 2 years old, 5 years old, 10 years old, 14 at puberty. When you gave them chemotherapy, you gave them radiation, you probably did surgery on them, you sent some of them to bone marrow transplant. Now you have targeted therapy and immunotherapy. But what we never think about when we are treating them is what is going to happen to them 10 or 15 years down the road. Those are the long-term follow-up important problems, and they are the late effects of treatment.
Yeah.
So coming to Georgetown, to this audience with a wonderful set of parents who I have to thank because they've been with me every single year over here to talk about their experience with their son, who today is a young adult cancer survivor who lives a full life.
Yeah.
But he had many, many, many challenges because he was only 2 when he was diagnosed. And at that time, we didn't know enough. We didn't know what radiation would do 15 years down the road. We didn't know what his growth would be like. We didn't know whether he would be tall or short. We didn't know whether he would have a second malignancy. This young man experienced everything that you'd read at in the books. And today, if you look at him, what does he like to do? He likes to barbecue, right? And he likes to barbecue cheese.
Yeah.
Am I
he does
correct
it,
about
yeah.
that? Yeah.
Yeah.
And he holds a job, and he is an icon of hope for young children who survive cancer and for their parents as well.
Yeah. Bill, wrap it up.
Thank you, Dr. Shad. The most incredible doctor. Has been at our side since 3 days after diagnosis, October 19th, 1996.
Wow.
And she has guided us through so much. And
There are a lot of storms together.
she's a dear, dear friend in addition to an untouchable professional. And empathy, and just knows how to work with people, but brings the expertise unmatched. So thank you, Dr.
Thank
Shad.
you.
Well, this is what teamwork is all about,
Yeah,
right?
right.
You work with the patient, you work with the family,
Yeah.
and you bring the healthcare provider in.
Yeah. Thank you so much.
Thank you.
Thank you.